So good morning all. Good morning to another live stream from AJINORAH. So we will wait a couple of minutes so that others can also join. So meanwhile, let's see the comment box. Fessy ma'am, hi.
Hi Ramya.
Hi Vipin sir. Good morning. Amal Sebastian, hi.
Hi Anila. Hi Anne Maria.
Shahina, good morning. Ajmal sir, good morning. Ludia ma'am, good morning.
Hi Shruti, good morning. Hi Alvin.
Hi Sonia, good morning. Elsa, good morning. Ashwati, good morning.
Good morning Roshan. Good morning Anne Marie.
Hi Lijesh. Good morning Christina.
Good morning Jinsi.
So good morning Renchita. So I think we can start our session. So let's wait for a few more seconds. Aksa, good morning. Remya, good morning.
Good morning Aishwarya. Hello Bijoy.
So I think it's time to start our session. So before beginning, let me introduce ourselves. So I am Alvin and
I'm Harsha.
we are OET trainers. So I hope you have seen the topic of our today's live streaming session. So before moving to the topic or before moving to the core part, we have some piece of happy news to share. So will you please share that?
Yeah, it's my pleasure. And we have a great news that we have a wonderful, as usual, we have wonderful results for OET, that for the exam which was held on February 25th.
Yes, so I would really first of all I would like to congratulate all the winners of the examinations, and I would like to extend my grateful thanks, not my actually all from all the part of AJINORAH, grateful thanks to the protagonist of the winners, that is all the OET trainers around us who invest their effort to fulfill the dreams of our candidates or of our students, right?
Yeah.
So that was a really big effort from our trainers, and I would like to thank them. So then coming back, we have a unlimited offer from AJINORAH. So it is related to Vishu, Easter and Eid, and we have an unlimited offer for OET and IELTS. So you can avail our unlimited offer, and you can contact the contact numbers, or you can contact the official number from AJINORAH. So I think it's time to move to our core part, right?
Yeah.
Okay, so you might have seen that our topic is decrypting Part B questions in OET reading. Decrypting Part B questions in OET reading. And so, Harsha, what do you mean by decrypting? And I'm pretty sure that some of may not be knowing what is decrypting or what we are going to do with this session. So, what do you mean by decrypting?
The word decrypting simply means to make it into a sensible or understandable language.
Yes. So, I mean, it is like decoding something.
Yeah, exactly.
Okay. So, we are dealing with, especially with Part B questions and a couple of questions from Part C. And apart from the tips and apart from the strategies, today our main intention is to make OET reading Part B easy for everyone. Okay, it is not based upon the linguistic ability, or it's not based upon the individual ability of everyone to read and understand. So it must be very applicable to each and every people. Okay, so that is our intention today, and we hope to do it our best of us. Okay. Yeah, so before beginning or before moving to the questions, I will just give a general overview regarding today's streaming. So we will to begin with, we will give a general orientation regarding the reading sub-test, 3 parts. Then followed by, we will have some sample questions, I think 6 of sample questions, and we will work on it together, and it is a kind of interactive session. Okay, so we will display the questions on the screen so that you can read the questions and you can find out the answer and you can comment it on the comment box. So I just Harsha, will you please give a general orientation regarding the OET reading subtest? I know everyone knows that. Will you please give a brief introduction?
Yeah, sure. So about reading subtest consists of 3 parts, that is Part A, Part B and Part C. And the Part A task is called as expeditious reading task, and you all know that the word expeditious means usually it's a random reading task, and the method that we use in the Part A reading task is skimming and scanning, and we really know what it is, right? And the total duration for Part A is 15 minutes, and next is Part B and C, and for Part B and C together we will call as careful reading task, and the total duration is 45 minutes. And in Part B we will just read the task. There will be a passage related to any clinical circular or guidelines or brochures or any internal communication such as any mails or memos, and there will be question related to that. And in B part we will be having 6 questions and with 3 multiple choice questions, and we will be having 45 minutes altogether for B and C. And for Part C, it's a little much compared to Part B. It will be really it's a complex kind of task, and most of our students usually complains that it is really tough. But don't worry regarding that. If you are practicing regularly, you can easily come out of that. And in Part C, you have 2 texts which can be of a word limit of 800 words, and you have total 18 questions in Part C with 4 multiple choice options.
Okay, so that is all about the reading subtest, right? So Harsha, if you don't mind, will you please share me your experience with the OET reading once you have joined for OET? So what was your experience with the reading? Was it easy, or was it difficult? What was your experience?
Oh, thank you, Alvin. Thank you so much for that wonderful question. Actually, for me, at first, as you all know, we will be having some little complexity with this reading subtest, and for me also it was really like that, and for the first time it was really tough, and on regular practice it became such a kind of a word puzzle game for me, because for Part A it was really easy, and my trainers always told me that that Part A is a part in which you can score good marks, and also on regular practice Part B and C was also very easy for me.
Oh, okay, so that is about you. So I am pretty sure that you must have felt bored when you are doing C part at the beginning. So I mean, what about now? Are you enjoying doing the C part?
Yeah, sure. Yeah, that's what I told you, that it's really easy now.
Yeah, so that is what we have to say. So enjoy the things that you are doing. If you are doing an extract, or if you are working on a C part or a B part, anything, enjoy the thing that you are doing, and that becomes very easier, right?
Yeah.
Okay, so then the next thing is we would like to notify you to begin reading habit, which is very important to crack OET reading subtest. So I hope everyone has a reading habit. So what about the reading habit? Is it very necessary to crack the reading, or have you? I know you have a reading habit. So what is your experience with the reading habit, or what kind of things do you read?
Actually, I was not a person who was not really into reading, because after coming for OET, I started to practice reading many books as we wish, and while reading also try to understand the meaning, and it doesn't mean how many books we read, or how many, in case of OET too, it doesn't mean how many materials you are doing. The thing is, if you are doing it fully and properly, and with the time limit and all, and if you are practicing it very appropriately, it will be really easy for you, and you can crack it very easily, and you can score good marks on that.
Okay, so as you told, for me also, I initially I don't like reading text. So the thing is that I just used to read the English newspapers. So actually my father used me to read the English newspapers daily, and I think that was one of the most beneficial thing that I had with my reading subtest. So the only thing that I do is to read the English newspaper. So it is not about the thing, or not about the books that you read, but it has to be in the English language. So that is the most important thing. And so reading is what you do regularly. So you might read the newspapers, Malayalam newspapers, or whatever your mother tongue is. You read your newspapers, you read storybooks, everything. So the only difference is that you have to do the same thing in English. So that is what we are doing in reading subtest, right?
Yes.
Okay. So then coming deeper into that, the OET reading subtest specifically check our ability to do three things. So the main three things is to extract information, then to synthesize information, and to comprehend information. So if you are able to do these three things, that is to extract, synthesize, and to comprehend, then definitely you can score a very good marks in reading, especially part B and C. And you have already told that part B and C is called careful reading.
Yes.
Okay, so that is the most important thing, or the most important tip that we would like to give to you. It is like careful reading. Please don't be panic. Make yourself calm. Teach yourself to be calm before beginning to do the part B and C, and we can definitely find out very correct answers for each and every questions, right?
Yeah.
Okay, so I would also like to mention about certain skills which is used to crack the OET reading. So like, you have to understand the viewpoint of authors, then the attitude of authors, then the detailed meaning. It is not about a particular word or a particular sentence, but we have to understand the detailed meaning of the text. Yeah. Okay, so that are regarding the skills, and as our topic is related to part B, I'm not going deeper into part C. Okay, so apart from that, I think there are some clues that have to be used while doing part B and C. Yeah. So do you know what are the clues, like names or something like that? What do you usually notice when you are doing part B and C?
Yeah, the keywords.
Yes.
Keywords that we choose for doing part B, maybe it can be our names, or percentage, or any kind of results or something. Is
yes.
that?
Yes, same as you told. It is like names, then it is like abbreviations, then the time scale, not at all the time scale, a thing that shows the scale, then the synonyms, the paraphrasing, then comparison, contrast. So all those are different. Comparison is different and contrast is different. So the chronological order, then time expression, modal verbs, then numbers and measurements. So all those are the clues that are usually used to notice the things in part B and C, right?
Yes.
Okay, so I think we can go to the questions, because as I already told, our intention is not to explain regarding the tips and strategies, but to make part B easier. So the the main thing, or the thing that you have to give priority, is to read and understand the text. The only thing that you have to keep in your mind is to read and understand the text. Okay, I am reading a particular topic, I have to understand the meaning of that. So then how will you, like, your question will be, how will you understand the meaning? Okay, so I would like to say you that they have to be or you guys have to be flexible. How can we be flexible? Do we need to stick to a particular protocol, or is there any other particular way to crack the reading?
Actually, in my view, I don't think that there is a particular rule or any appropriate protocol on that. In which method, if you feel appropriate and you can do it in a very short time, and also you are able to score good, it is the best thing. I think
yes.
It is the best thing.
So that is the thing. As she told, we have to be very flexible, and as I tell, the intention is to read and understand the extract, and you can undertake all those measures by which you can understand a particular text. Okay, so the thing that I used to follow is to read the extract in my mother tongue. Okay, so my mother tongue is Malayalam, so I used to read the extract in Malayalam so that I can understand the meaning and I can get the general idea or the overview of that particular paragraph. So it is very easy to identify from the options and from the questions. And I would also like to break a mythology, like there are similar options in part C, similar options in part B. There is nothing like that. All the 4 options in part C and all the 3 options in part B are very distinctive, and once you look carefully into that, you can find the difference of these options. And how can they give similar options? How can give the same options? Definitely there will be a different a small mistake there in the paragraph or in the options, like it may be with is or was, has or had, anything, the usage of tenses, anything, there will be a kind of changes or a difference in the options. So that is why I told all the options are very distinctive, right?
Yes.
Okay.
As you have already told, many students have told that, ma'am or sir, we have 2 options same as like that, but there will be some minute differences between these options. When we carefully read that and compare it with the passage, we can understand that different minute changes in that.
Yes. So then for your kind information, we have 3 patterns of question in part C: factual question, opinion questions, and lexical questions. And we have already done live streaming regarding how to answer lexical questions and how to answer opinion or suggestion type of questions. And if you want, you will get the recorded video from our YouTube channel, so you can go and refer to that. So there is a detailed live streaming session on how to answer factual or opinion questions, then lexical questions, everything. Okay, so I hope you will go and refer to those videos. So I think we have to move to the questions, right?
Yeah.
Okay, so before that, I would like to tell you that please do comment and we will display a particular question on the screen, and we will give a couple of minutes to you to answer the questions. And please do comment the answers in the comment box. And it as I told earlier, it is like an interactive session, and we will discuss how we came to that answer, and we will have a general outlook to make the extract simple. Whether it is hard, scientific, or anything, we will make the extract simple and we will understand the general meaning of that, right?
Yes.
Okay, so I hope you are ready, and we will see the questions. Okay, so I hope you can see the first question. So if there is any lack of clarity in the screen, please do comment in the comment box. So the first question is, the instructions state that disinfectant should be used. Okay, so once again, will you please read the question?
Yeah, sure. The first question is, the instructions state that disinfectant should be used.
Okay, so many of the students mark the keyword as disinfectant. Okay, so I would like to say that here the keyword is should be used, right?
Yes.
Okay, so should be used means what is the meaning of should be used?
It should be particularly focused on something.
Yes, I mean the answer will not be a or there is nothing us to assume or something like that. Okay, so it is like the instructions state that disinfectants should be used. Okay, so before moving to the paragraphs, you might be following a particular guideline, like read the question first, then the text, then the options, anything. But I would like to say that please don't follow a particular method for every questions, because that is why we told you to be flexible, right? So in some options, for some questions, the options will be very small, so that you can memorize the options when you are reading the extract. For such cases, you can read the options also together. And how will we make the options lighter or the options smaller? Is like, let's see the three options here. We have got three options, and the option 1 is
via the process of mechanical cleaning.
Okay, via the process of mechanical cleaning means, will you please read and understand the meaning of the option?
Yeah, it means through a process of mechanical cleaning.
Okay,
It's
through the
simple,
process
right?
of mechanical cleaning. Okay, so we have understood the meaning of the first option. Then B.
In combination with physical cleaning.
Okay, so the words are in combination, then with. Okay, so in combination with physical cleaning means we have to use at the same time when you are doing the physical cleaning,
Yeah.
right? Or it has to be used together in
Yeah.
combination with physical cleaning. I hope you are getting the meaning of the options. Then option C, only at the time of manual cleaning. Only, see, only at the time of manual cleaning. That means it can be used only at the time of manual cleaning. So I think the options are very clear to you. So you just we will display the question. Yes, so this is your paragraph. It is with use of disinfectants. See, in acute care settings where there is uncertainty about the nature of soiling on the surface, example, blood or body fluid contamination versus routine dust or dirt, or the presence of MROs, including Clostridium difficile or other infectious agents requiring transmission based precautions. Example, pulmonary tuberculosis is known or suspected. Surfaces should be physically cleaned with a detergent solution followed or combined with a TGA registered disinfectant. Okay, so will you please comment the answers in the comment box so that we can discuss the answers. So Harsha, yeah, we'll give. I think there are some answers like B. Then yes, B. So I think everyone is getting the answer B. Okay. So before confirming the answer, will you please tell the summary of this paragraph?
Yeah, sure. In a care setting, it says about a cleaning procedure and what should be used in order to clean in case of any infectious agent is there.
Yes.
And by the end, we can see the surfaces should be cleaned with a detergent followed or combined with a TGA registered disinfectant.
Okay. First of all, then it is physically cleaned. Then we will just have a look at our question. Where is anything with physical? Yes, so you can see the word physical cleaning here. So this is how you have to mark your options and your paragraph, and you have to give the prime consideration or the prime importance to your question and your options, and after that only comes your paragraph. The very important thing is the question and the options. It is not about understanding each and every meaning of the sentences in your paragraph. Rather than that, you have to read and understand clearly the options which is given there in the question. Okay, so now see, when we saw the word physical cleaning, we just remember that we had a name called physical cleaning in our option, right?
Yes.
See, then with a detergent solution. Okay, surfaces should be physically cleaned with a detergent solution followed or combined with a TGA registered disinfectant. So our question was, disinfectant should be used. Okay, when a disinfectant should be used. See, this is TGA registered disinfectant. So you might be confused. What is TGA registered disinfectant? It is not needed. Disinfectant is what we needed, and TGA registered disinfectant is maybe a kind of brand name or something like that. Okay, so disinfectant. Then the thing is that followed or combined with. So we will first look for the word followed. Is there anything related to followed? Via the process of mechanical cleaning is not related to followed. In combination with physical cleaning is not related to followed, only at the time. So we cannot see followed by. Okay, so but please wait, we have another word, followed or combined. It is not followed and combined, it is followed or combined. It is completely another way. Okay, or combined with a TGA registered disinfectant. Okay, combined with means
Along with.
or to be used together. Okay, so see, in combination with, the word combined with and in combination with, right?
Yes.
See, combined with and in combination with. So I hope you can understand the meaning of these two. The meaning of these two words or these two options are same.
Yes.
Okay, so we have already got our answer, in combination with physical cleaning. So the answer is option B, in combination with physical cleaning. So I hope, let's see the comment box. Yes, most of you have commented the right answer, B. Yes, some of them have commented A. So I think those who have made a mistake, the answer is now clear. With that, why we chose the answer, the option B. And if you have any doubts, please comment it in the comment box. Okay, so shall we move to the second question?
Yeah, okay.
Okay, so the second question is, the guidelines are providing information about. Okay, so some of you may have already done this question, but we can discuss it. The guidelines providing information about. So the set of guidelines is coming, and we have to find what information do we get after completing reading that guidelines. Okay, so will you please read the options?
Yeah, option A, when a basal test should be conducted.
When a basal test should be conducted.
And option B is the steps for conducting a basal test.
The steps for conducting a basal test.
And C is who should perform a basal test.
Who should perform a basal. So how can we make it short? These three options, how can we make it short?
Yeah, in these options, we can simply choose some keywords. In option A, it says about when a basal test should be conducted. In that, we can choose the word when. That
okay.
It says about a particular time or something.
Okay, so that is a keyword. When. Yeah. Okay, when.
And in option B, the steps for conducting the basal test.
Okay.
I think the steps.
Steps, yes.
Yeah, the steps can be chosen as a keyword. And the third, the C option is who should perform a basal test. It says about a person or a particular person who should perform a basal test.
Okay, so I would like to say that you just forget about the remaining part of the option. Like a basal test should be conducted, conducting a basal test, performing a basal test. It is not necessary to remember the remaining part of the option, as we know that our guidelines will be about basal test. Okay, yes. So our guidelines is regarding the basal test, and the only thing that we must know is when, or the steps, or who. Okay, see, I hope it is clear with that. Will you please write these three keywords here?
Yeah.
When, then steps, and who. Okay, so we will have a look at the paragraph. Management of adults using insulin pump therapy. So same as the last question, please comment the answers in the comment box. In preparation for a surgery, it is necessary to establish a consistent, stable blood glucose concentration in the fated state, requiring a basal test to be performed. Requiring a basal test to be performed. The early involvement of the diabetes team in people on an insulin pump preoperatively is paramount to facilitate this optimization of glycemic management. Okay, the overnight basal assessment can be performed at least few days or weeks before surgery to allow sufficient time for input from the diabetes specialist, if necessary, to adjust and confirm the new settings by repeating the basal assessment. The timing of the assessment can be extended to cover the proposed timings of surgery. For example, if surgery is planned for 9 a.m., then the basal assessment could cover the overnight period up until late morning. So I think you can see the paragraph. So before moving to the options, before that we'll just have a look. Then, Harsha, who should perform a basal test?
Actually, Alvin, I couldn't find anything related to that on that passage.
So you cannot know that who is gonna do a basal test. So it's nothing related to a professional or anything, right?
Yes.
Okay. So I hope you also get the same opinion as us. Then B, the steps for conducting a basal test. So Harsha, will you please brief the steps for conducting a basal test?
Actually, it is really confusing, and I couldn't find anything related to any step.
Okay, so see, after reading this paragraph, first of all, it is difficult to understand what is a basal test.
Yes.
Okay, that is also not here. What is a basal test and the steps of basal test, because there is nothing related to steps or something like that. So we know that it is, if it is like steps, it might be some procedures, right? Or you should do like this. You should make the patient stable. Anything related to the steps. Okay, so we are nurses and we know how a steps or how a description of steps look like. Okay, so this OET is always related to things that you daily, as nurses, you do daily. Okay, so you know how our description related to the steps is like that. So this is not related to a steps. Okay, then option A is when a basal test should be conducted. Okay, already we have eliminated the two options, and we can confirm that option A is the answer. So first of all, it is like basal test to be performed, then the overnight basal assessment, then timing of the assessment, timings of surgery. See, the last scope of intervention is that the word which is repeating in this paragraph is timing. Here is this is a timings of surgery. Overnight is a time scale. See, so when the word when is often used to depict a kind of time scale, time or something like that, right? So do you have a different opinion?
No, it's I think the answer can be right.
Yes. So the answer is option A, when a basal test should be conducted. So see how easier we just decoded. So that was our topic. So see how easily we decoded a set of informations. Our paragraph consisted of a set of information, and we can effectively decode the things into simpler ones. So consider whether it is scientific, as I already told, whether it is scientific or anything else, consider this as simple and decode the information into your language. Okay, so we have to understand, we have to read, and we have to understand the meanings. Okay, so let's see the answers. Yes, most of you have given the correct answer. Liamol, Sajna, and Naskaria. So congratulations all. So I think they are very good in reading. Yes. So we'll move to the very next question. So this is our next question. The policy extract states that doctors and specialists who visit the hospital must. So will you please mark some kind of keywords in the question?
In this, the policy extract says that the doctors and specialists who visit the hospital must. So they are telling that there are some people they are mentioning, that is doctors and specialists, and also visit the hospital must. And they are telling compulsorily they should follow.
So the word must means we do not have any other option on that. So we have to strictly follow some kind of information or some kind of guidelines. Who have to follow? Doctors and specialists. Okay, so will you please read the options?
Option A, wait for the emergency officer to provide advice on safety procedures.
Then wait for the emergency, another word is emergency officer or another professional. Then B,
option B, follow the instruction of the area warden or emergency officer.
Okay, so they must follow the instructions of the area warden or emergency officer. Again, area warden. Then
option C, listen to the emergency officer until the area warden arrives.
Okay, so until the emergency officer, area warden. Okay, in option C, emergency, they have to or they must listen to the emergency officer until the area warden arrives. And in option B, the emergency officer and area warden they have to follow the instructions of both the area warden and the emergency officer. And in option A, they have to wait for the emergency officer to provide advice on safety procedure. Okay, for this kind of questions, I would recommend you to read the paragraph first and come back to the options, because yeah, we can understand the meaning of the options, but there is nothing to make it simple, or as we did in the last paragraph, last question, there is nothing to make the options simple. So I think we have to read the paragraph first. Okay,
Yes.
so we'll see the paragraph. Okay.
So, emergency response procedures. We are committed to ensuring a safe environment and appropriate emergency preparedness for our visiting doctors. In the event of an internal emergency, the person in charge has legal authority to direct all parties. Initially, the person in charge will be the area warden, who will be identified by a yellow hat or vest. Once the emergency officer arrives on the scene, they will support the area warden. The emergency officer is identified by a white hat or vest. Everybody on site, no matter how senior, is legally required to follow the directions of the area warden or emergency officer. Therefore, the primary role of visiting specialist in an internal emergency is to follow the instructions of those in charge.
Okay, so this is regarding some kind of emergency response procedures. Then, a simple first paragraph. We are committed to ensuring a safe environment and appropriate emergency preparedness. There is nothing related to our answers. Okay.
Yes.
Then, in the event of an internal emergency, the person in charge, again, person in charge, it might be an emergency officer or it might be a area warden or anything else. Okay. Legal authority to direct all parties. Then it is again all parties. We have to understand a particular specialist or doctors. That was our question. So, initially, the person in charge will be the area warden. Okay. So the person in charge is area warden, who will be identified by a yellow hat or vest. Okay, so here is the keyword is area warden. Once the emergency officer arrives on the scene, they will support the area warden. Again, here the area warden and the emergency officer works in close proximity. So the in charge is the area warden, and once the emergency officer arrives, he will accompany or he will support the area warden. Okay. Then the emergency officer is identified by a white hat. Okay, it's not needed. Then coming to the last paragraph, everybody on site, okay, no matter how senior, okay, see, it is irrespective of the seniority, the professions, anything. Okay, no matter how senior, whether it is doctors, whether it is nurses, whether it is the normal people, anything is legally, again, legally. So anything which is legally is a must. Legally required to follow the directions of the area warden or emergency officer, and therefore the primary role of visiting specialist in an internal emergency is to follow the instructions of those in charge. Okay, so precisely this is our answer. Therefore, the primary role of visiting specialist in an internal emergency is to follow the instructions of those in charge. Okay, see, doctors and specialists who visit the hospital, doctors and specialists, and here specialist, visiting specialist in an internal emergency. So they must follow legally, they must follow the instructions of those in charge. So who is the in charge? Area warden or the emergency officer.
Yes.
Right? So I hope you have already understood the meaning. So we'll see the options. Option A, wait for the emergency officer to provide advice on safety procedures. See, you just have a general look on this paragraph. We have divided this paragraph into many simpler elements, right? We have actually broken down the paragraph. Okay, there's nothing to read now because we have eliminated many things. See, we have eliminated many things, and there are only hardly 4 or 5 lines to read, and from that 4 or 5 lines we have just to find out the answer. So there is nothing like wait for the emergency officer to provide advice on safety issues. So we can eliminate that. Option B, follow the instructions of the area warden or emergency officer. So this is what we have just informed them, because see, therefore the primary role of visiting specialist in an internal emergency is to follow the instructions of those in charge. So the answer is option B, follow the instructions of the area warden or emergency officer. Then Option C, listen to the emergency officer until the area warden arrives. This is completely wrong. Actually, this is like this. Listen to area warden until emergency officer arrives. See, there is a factual mistake in the option itself. And
Yes.
as I told, we have divided our paragraph. We have eliminated the unnecessary informations, everything from the paragraph, and the remaining was 4 or 5 sentences. And we can easily pick out the answer from that sentences. Option B is the answer. Follow the instructions of the area warden or emergency officer. And again, yes, very good to see that most of you have made the correct answer. Some of them have commented A, then B. So what about here?
Yeah, everyone is saying the correct answer. That is option B.
Yes, again, congrats to those who have made the answer correct. And this is how you can make your reading simple. Okay, so we'll move to another question. So this is a question from part C. Actually, this is a lexical question. So this type of question is called lexical questions. And the question is, the phrase largely reassuring in the 4th paragraph expresses the idea that. So this is a question from part C. So largely reassuring. I mean, what do you mean by reassuring or reassurance? What do you mean by that?
It means just it gives a positive impact or positive feedback.
Okay, so it is like a some shade of positiveness, right?
Yes.
So before moving to the paragraph, we can see the options, and we have 4 options. Since it is from part C, we have 4 options. And the thing is that when you are reading the 4 options, you might feel that this option is largely reassuring. Okay, so that is what we told. You have to enjoy the things that you are doing. When you are reading the options, see, kind of reassurance, positiveness, happiness, all these are kind of emotions that we can also feel.
Yes.
Okay, emotions we can also feel when you're it is a kind of emotions. So when you're reading a novel, you might also feel the same emotions as the author. So that is what we have to apply here. So the option A is, there is an important link between some diseases and regular coffee consumption. So they say that if we consume regular coffee consumption, it may lead to some kind of diseases. Is it largely reassuring?
Not at all.
Okay, so that is not at all a reassuring kind of statement. So I think we can eliminate this. Okay, we can confirm while we are reading the paragraph. So before that, we can slightly eliminate that. Then option B is, drinking coffee daily appeared beneficial for certain type of diseases. Yes, so if something that we do usually or something we do regularly is beneficial, then that is a kind of reassurance or a positive
yes.
thing. We are happy to hear that. So this is a kind of reassuring sentence. Then option C, there are no negative effects associated with drinking coffee. Yes, that is also kind of that is a normal thing. Okay, no negative effects, nothing more in that, but still that is a reassuring sentence. Then D, routinely drinking coffee makes people feel better. Yes, that is also kind of reassuring sentence. So we have now got 3 reassuring sentences, and let's compare. Okay, see, we are going to compare the options. Drinking coffee daily appeared beneficial for certain type of diseases. Certain type of diseases means, see, you just imagine that you are a person who drinks coffee daily, and there are many hypotheses that drinking coffee is harmful or something like that. Okay, you have heard that, but still you continue with drinking coffee regularly, maybe more than 4 or 5 cups a day, and suddenly you heard that if you for people who drink coffee more than 4 or 5 days daily, have a greater recovery rate for certain kind of diseases, whatever diseases it might be, it has got a greater magnitude of recovery. So is that kind of reassurance? What kind of feel that you are going to get that when you hear that?
When it will be feeling better.
Yes,
right?
so it is a thing that we usually do, or we do regularly, and if it is beneficial for any kind of diseases, then we can prevent prevent going to hospitals, the medication expense, everything. See, so that is a kind of then the option C is, there are no negative effects associated with drinking coffee. This is also reassurance. And when you compare these two, which is largely reassuring? Which option is largely reassuring?
Because in option B it says about certain types of diseases,
Yes.
right? So I think this is largely reassuring that any other
Yes.
C and T.
Reassuring and largely reassuring means double the impact, double the positive impact. Okay, largely reassuring. We can say that this is somewhat more reassuring. And when you compare with D, routinely drinking coffee makes you feel better. Yeah, that is a kind of normal thing. It feels better. But you just see, I will just quote you an example. Reading books or studying, no, leave reading, okay. Studying a thing daily, studying parents have told us that you have to study the things which is taught in the school the same day. Okay, if you do like that, it will really help you to score good marks in exams.
Yes.
That is a kind of option is this. Routinely drinking coffee makes people feel better. But see, just imagine your teacher says that if you do a certain thing, it will definitely make you to pass the examinations, or maybe you're in a subject in which you are very weak at. Okay, for example, majority of you may be weak at mathematics. Okay, yes. So if you do something regularly, definitely you will pass the mathematics examination. So which is the most reassuring thing?
Actually, in case of that mathematics case, it
Yes.
is really reassuring for me.
Yeah, so see, when compared to option D and option B, again we can see that option B is more reassuring. Okay, so finally we have come to a conclusion that option B can be largely reassuring. Okay, let's go to the paragraph. So it is not necessary to read the whole paragraph. We will read a couple of sentences from here. Okay, so will you please start reading from here?
She added that the evidence for coffee in managing type 2 diabetes and cardiovascular disease was largely reassuring, and that consumption of 2 to 4 cups a day is not associated with adverse effects.
See, she added that evidence of coffee in managing certain kind of diseases, managing type 2 diabetes and cardiovascular disease, certain kind of disease, was largely reassuring. See, largely reassuring. So our intention was to understand the meaning of the word largely reassuring, and you will see the options. See, beneficial for certain type of diseases. That is, what are the certain type of diseases? Type 2 diabetes and cardiovascular disease. So see how before reading the paragraph, how we come to a conclusion that our answer is option B, and definitely the answer is option B. Drinking coffee daily appeared beneficial for certain types of diseases. So I hope you understood the options, or how we decode our options. Okay, yes. Again the word decode. So we'll see the options. Yes, now they are commenting B. Yes, Alina, Sajida, Bhavya, Annie. Okay, everyone is commenting the right answer. Happy to see that. Okay, so okay, Alfonso. Okay, so this is how we should make your extract feel simple. Okay, then we'll move to the next question. See, this is a kind of confused question. Okay, so I think majority of you have already done this question, and many of you make mistake usually when we take classes for the children, right? Okay, so this is, what does ethical code recommend to protect the patients of an impaired physician? Okay, so this is a B part question. Ethical code recommend to protect the patients of an impaired physician. Okay, so I think do we need to read the options, or do we need to read the paragraph first?
We can read the paragraph first.
Paragraph. Okay, so see, what does ethical code recommend to protect the patients of an impaired physician? To protect the patients of an impaired physician, what have to do? Okay.
Extract from ethics manual, that is impaired physician. Every physician is responsible for protecting patients from an impaired physician and for assisting an impaired colleague. Fear of mistake, embarrassment, or possible litigation should not deter or delay identification of an impaired colleague. The identifying physician may find it helpful and prudent to seek counsel from a designated institutional official, the departmental chair, or a senior member of the staff or the community.
Okay, just a second. So we have completed reading the first paragraph, and we will have a glance at the question. What does the ethical code recommend to protect the patients? There's some kind of options. Then I think now we can just have a glance at the options to get a general idea of what we are going to work in. So the A is, the physician of the impaired physician should not evaluate the impaired physician's progress. So it means that the physician of the impaired physician is not allowed to evaluate the the physicians. Yes. Then coming to option B, the physician of the impaired physician should not treat the impaired physician's patients. See, okay, so the physician of the impaired physician should not treat. Okay, see the word should not treat. Then option C, the physician of the impaired physician should monitor the impaired physician's fitness to work. Should not. Okay, one should and two should not. Okay,
Yeah.
so we have already completed reading the first paragraph. And have you seen any kind of statement which is related to the options?
No.
No. So we can completely eliminate this. See how we became flexible.
Yes.
So this is what we told to be flexible. So I am very sure that no one is going to go back to the options once you finish this first paragraph. So we went back to the options after reading the first paragraph in order to get a clearer idea on what we are reading. So now we can completely eliminate this first paragraph. It is not of use. Okay.
Yes.
So will you please read the second one?
Yes. Although the legal responsibility to do so varies among countries, there is a clear ethical responsibility to report a physician who seems to be impaired to an appropriate authority. Physicians and healthcare institutions should assist impaired colleagues in getting appropriate treatment. While undergoing therapy, the impaired physician is entitled to full confidentiality as in any other patient-physician relationship.
Okay, will you please stop this? So what should we do?
I don't think there is any content related to
any content, and also nothing related to the
options.
See, 3 options and there is nothing related to the options. So you just read up to here, right?
Yes.
We can
eliminate
eliminate this. Okay, then simple 3 lines, and we have to find out the answer, which is very easy. Okay, will you please read?
Yeah. To protect the patients of the impaired physician, someone other than the physician of the impaired physician must monitor the impaired physician's fitness to work. Serious conflicts may occur if the treating physician tries to fill both roles.
Okay. Do we need this last sentence?
No.
No. So we can eliminate this too. See, in this whole paragraph we have 2 sentences to find out the answers, right? Okay, so to protect the patients of impaired physician. To protect the impaired patients of an impaired physician, someone other than the physician of the impaired physician must monitor the impaired physician to fitness to work. So that means that the physician of the impaired physician is not allowed to monitor the impaired physician's fitness to work. Right.
Yes.
Okay, someone other than means that same person is not allowed to monitor. Right?
Yes.
See, option A. The physician of the impaired physician should not evaluate the impaired physician's progress. I mean, will you please correlate option A and our sentence?
Yeah, the option A says the physician of the impaired physician should not evaluate the impaired physician's progress.
Yes,
I think
so
it's almost related.
Same. That means the physician of the impaired physician is not allowed to evaluate the impaired physician's progress. See, someone other than the physician of the impaired physician must monitor. Someone other than the physician must monitor.
Okay.
Someone other than means, will you please tell that? Someone other than.
That means that particular person is not allowed to do so.
Not the same person.
Yeah.
Okay. Someone other than the physician of the impaired physician must monitor the impaired physician fitness to work. Okay. Option B. The physician of the impaired physician should not treat the impaired physician's patients. Where is something related to treatment or treat patients or anything like that?
No, there's nothing related to that.
No. Okay. Then option C, the physician of the impaired physician should monitor the impaired physician's fitness to work. So here says that that same person again should monitor the impaired physician of the fitness. So is that a kind of bias, or it is a kind of partiality that already an impaired physician is there, and if the physician of the impaired physician is again made to evaluate the fitness or work or the progress, is that possible?
No, it's according to the context, it is really opposite to that, and also by reading this option C itself, we can understand that it's really a blunder or something.
Yes, see, someone other than the physician of the impaired physician.
Yeah.
So now I can see the comment box. Everyone commented that the option is C. Many of them commented C, and now you are commenting back A. So how you see how the answer changes when you understand the exact meaning of the sentences. So that, see, you should enjoy what you are doing, and you should correctly synthesize, then extract and comprehend the meaning. Okay, so we have done this and we have understood the meaning. Okay, so I hope you have got a clear idea. Here the answer is option A. The physician of the impaired physician should not evaluate the impaired physician's progress. Okay, I think it is clear, and I think the questions are clear with you, and we will move to one more question, the last question. Okay, this is a question from part C. Then, what concern does Professor Eliseo Gualar have about coffee consumption? Okay, so this is concern, same as what we saw in the last not the last question, the lexical question, largely reassuring. Okay,
Yes.
so this is a emotion, concern. So concern is the emotion, and before moving to the paragraph, when you read the 4 options, you might feel the same concern.
Yes.
Okay, because that is an emotion and you might feel the same concern. Okay, so will you please read the options?
Option A, clear conclusions can be made about the benefits of drinking coffee. Option B, there may be health risk attributable to products taken with coffee. And option C, not enough doctors are recommending coffee's health benefits. And option D, there haven't been enough studies conducted about coffee.
Okay, no clear conclusions can be made about benefits of drinking coffee. Is that a statement of major concern?
No, it doesn't sound like
It
a
goes
concern.
normal. Okay, no clear conclusions can be made. Okay, it goes normal. Then come to option B.
There may be health risk attributable to products taken with coffee.
Oh my god, I mean that is something serious or some kind of concern, because see, coffee is a thing that we usually take, and if someone says that there is a some kind of health risk is there with the things which is taken with coffee, so that is a statement of concern, right?
Yes.
I mean, yeah, I'm concerned on that because I usually drink coffee. So option says that not enough doctors are recommending coffee's health benefits. Yes, coffee may have health benefits, may not have health benefits. If the doctors are not recommending, that is not a point of that much concern. Okay, see, then option D, there haven't been enough studies conducted about coffee. See, all these are a kind of negative shades, or there is a concern, but according to the question, see, for my opinion, the option which I am concerned most is option B. There may be health risk attributable to products taken with coffee. And before that, we will confirm in here. Okay, so in a linked editorial, Professor Eliseo Gualar from the John Hopkins Bloomberg School of Public Health in Maryland wrote that yes, coffee is safe, but hold the cake. Coffee is safe, but hold the cake. What do you mean by that?
When we usually will be having coffee with snacks or something.
Yes.
So I think.
Yeah. Wait. Okay. Wait.
Yeah. Wait for a second.
Yeah. He argued that the latest study. See. Okay. See. She said that coffee is safe. Okay. I'm relieved. Oh my God. Yeah. Then coffee is often consumed with products. So here is it. Coffee is often consumed with products rich in refined sugars and unhealthy fats. See. That is right too. It is considered rich in refined sugars and unhealthy fats, and these may be independently contribute to adverse health outcomes. See?
Yes.
So what is the meaning of that sentence?
Because there can be some harmful effects due to the refined sugars.
Yes. So products taken with coffee. Coffee is consumed with products and products taken with coffee. Then the next word is attributable and contribute. Is that same?
Almost.
Yes. So it is a kind of synonym, or is not a synonym, but it is a kind of paraphrasing.
Yes.
Okay. So when you take these unhealthy fat, refined sugars, or anything with coffee, it may contribute to adverse health effects. Okay. And the option B was there may be health risk attributable to products taken with coffee. So I think again the answer is very clear. So answer is option B, right?
Yes.
Okay, so this is again how we make things simple. You even, especially when you are dealing with emotions, surprise, anything, you must feel surprised, you might feel concerned, and you might feel positive, negative, anything. Okay, so the answer is option B, and let's see the comment box. Yes, most of you have got the correct answer. Option B. Reshma, Divya, yeah, everyone, congrats for those who got the correct answer. And what about here?
Yeah, here also everyone have mentioned the correct answer. That is option B.
Yes. So I think now you got a better idea on how to make the extract simple and how to consider OET reading subtest as a simple thing, and how to enjoy the things that you are going to do. So I think it was a bit beneficial for them, because frankly, it was beneficial for me anyways, because I too understood how to make it simple, because we are enjoying what we are doing.
Yes.
Right. So then we will just wait a couple of minutes, so that if you have any concerns or any doubt, please post in the comment box. You will just wait a couple of minutes. So is there any comments? So I hope this was a useful session for you, because it was the kind of interactive session, and everyone answered very correctly. And so if there is no doubts, I think we can wind up our session. So if you have any further queries, you can post it in the comment box, and we will answer in comments. So again, we will come up with another live streaming session soon. Yes, before that we have a doubt. Is it possible to cut sentences in examination paper during exams? Okay, so yes, you can underline, or you can do anything in the OET answer booklet, or in which you receive for the examinations. You can do anything. You can underline, you can mark. That is, we are already doing when you are doing a part or anything. Okay, so yes, it is possible to do that. Okay, so I think we can wind up the session. Again, definitely we'll come back with another interesting session, maybe of part C or part A, anything. So thank you guys, and I would like to extend my thank to the technical team who just kept this stream uninterrupted. Okay, thank you so much.
Thank you so much.